Good evening, everyone in this house. My name is MUSIIME EDSON. I'm going to discuss congenital anomalies of the heart. Not forget that I'm here too doing bachelor's of medicine and surgery. So today we are going to look about cardiac pathologies. More specifically, we are going to look at the congenital heart diseases, or sometimes they are called defects. So, under our objectives, we shall look at definition of the congenital heart diseases. We shall look at the major causes of the congenital heart diseases. We shall look at the classification of the congenital heart diseases. And we shall also look at, and actually we shall understand clinical presentation of the congenital heart diseases. And we shall also look at the complications and the possible management of these congenital diseases. So, by definition, congenital heart diseases or congenital heart defect is a heart abnormality present at birth. So, meaning that we diagnose them or we experience them at birth. Then we said that congenital heart diseases is a multifactorial disorder associated with both genetic and environmental factors. So meaning that it is not, it has no specific cause. It is like a group of conditions which can lead to these effects. So this is the structure of the heart. It is showing us how the normal blood flow is in the heart. And it actually shows us the structure of the heart, how the heart is made. And then it will also enable us to understand where these congenital heart diseases are or happen in the part of the what? The parts of the heart. All right. Major causes of the congenital heart diseases, since we've said that it is a multifactorial and it may be genetic predisposition. Of course, we have some genetic predisposition or genetic disorders that we have can lead to heart disease, as we shall see. We can have environmental factors like taking certain prescription of drugs during pregnancy. We have alcohol consumption during pregnancy. It is also very dangerous. It can predispose you. Viral infection of pregnant mothers during the first trimester or 3 weeks of the intrauterine life of the fetus, e.g. like rubella virus. We have diabetes mellitus in pregnant mothers, can also make you make the baby to be exposed to congenital defects. Let's look at the classification of congenital heart diseases. So congenital heart defects or diseases are classified into 3 categories, which include malposition of the heart. It can also be due to the shunts. It can also be due to obstructive. So we classify them like, there are those ones which are malposition. The heart is not in the area where it is supposed to be. Take an example in ascites inversus, where you find that the heart, which is supposed to be on the left, maybe it is on the right. So the body perceives it like, yeah, it is the normal area. So it is also not normal way. Then we have shunts. These shunts, we shall find that these shunts are, in most cases, they are normal blood flow in the intrauterine life of the what? Of the fetus. So you will find that these shunts, when they persist after birth, they will result into heart defects. Then we have obstructive diseases. These ones, we shall also look about them and how they present. We already talked about this malposition, whereby we said under this condition, the apex of the heart points to the right side of the chest instead of the left. So it is accompanied by ascites inversus. However, isolated extracardio is associated with the major anomalies of the heart, such as transposition of the atria in relation to the ventricles or transposition of the great arteries. We have shunts, as we said, like in the fetal saturation. These are the very important ones, like in fetal saturation, whereby you find that most of the fetus blood, it is coming from the what? From the umbilical cord, actually from the mother. So these shunts are important because it's the one which actually perfuses the what? The fetus. These shunts, we have ductus venosus, we have ductus anteriosus, and we have foramen ovale. Foramen ovale, it is within the what? Within the heart. So these shunts are divided into two. We have left to right shunts, which are acyanotic or late cyanotic, and we have right to left shunts, which are cyanotic. So now, left to right shunts, these are the conditions blood contains. Under these conditions, actually, blood contains enough oxygen, but it's pumped throughout the body abnormally. And the defect does not interfere with what? With amount of oxygen or blood delivered to the what? The rest of the body. Hence, it is compatible with life. So a person with this acyanotic, he can survive. Examples of this, we have ventricular septal defect, and this one, it is associated with genetic disorder, which is Down syndrome. We have atrial septal defect, which is associated with Noonan syndrome and Down syndrome. Then we have patent ductus anteriosus, which is associated with Down syndrome. So left to right shunts, majorly, structurally, as we said that previously, we shall look about them, where do they happen. We have patent ductus anteriosus. It is linking this aorta to the what? To the pulmonary what? To the pulmonary artery, to the lungs. Then we have atrial septal defect. So it is linking two arteries of the heart, left and right. So they are communicating, and in normal situation, they are not supposed to communicate. Then we have ventricular septal defect. So this is the communication between two ventricles, like left and right ventricles. Clinical presentation under this one, as cyanotic, we have breathlessness, dizziness, we have fatigue, which is extreme tiredness, and we have fainting. You can faint. Then diagnosis, we can use just X-ray, electrocardiogram, as we shall discuss, echocardiogram, heart catheterization, perinatal sonography, and pulse oximetry screening. I think the year series and year fours, you are going to take us or explain to us very well. Management, yeah, some possible managements. We have catheter procedure to produce plug into the what? To the defect. We can have medication to help the heart work more efficiently, like to control the blood pressure, because they are cyanotic, so you can leave them. But within a later life, you can develop what? Hypertension. We can have surgery to close the defect, and even we can have heart transplant where possible. Then we have right to left shunts, and these are cyanotic defects. So this group of congenital heart defects in babies, in which there is shunting of poorly oxygenated blood from right side to the left side of the heart, then into the systemic saturation. This results into RA cyanosis. This is bluish coloration of the what? Which can lead actually into hypoxia, which can lead to ischemia, necrosis, tissue death, and it is not compatible with life. Under these ones, we have the tetralogy of Fallot, which is made up of 4 defects. We have Down syndrome. Actually, it is associated with genetic disorders like Down syndrome, Williams syndrome, and Alagille syndrome. We can have transposition of great arteries. We can have persistent structures, arteriosus, tricuspid atresia, and stenosis. Clinical presentation of this one, majorly is cyanosis, which is blue color of the skin on the fingers, toes, and lips. Can have breathlessness, feeding trouble, fatigue, anxiety. So you have to note that diagnosis of cyanotic and acyanotic heart defects, in most cases, we use the same methods. Under this one, we have obstructive heart.